Hi, my name is Alex Kimbrell. I'm a student physical therapist assistant from Jeff State. Today we're going to be talking about industrial rehabilitation interventions. So, what is industrial rehabilitation? It is like physical therapy because the goal of it is to teach a patient to perform their job safely. May be needed before or after an injury or to prevent injuries from happening. It can be done with the use of assessments of the workplace, exercises, patient education, and therapy. There are two different types of industrial rehabilitation. Um, this is important to know because it can help you identify different interventions that may need to be done by the time that they're going to be leaving. There is work conditioning, which is for 4 hours every day, 5 days a week for 8 weeks. And there's work hardening, which is 4 to 8 hours, 5 days a week for up to 8 weeks too. Interventions selected should relate to the patient's job and it should be selected for strengthening, flexibility, control, endurance training, cardiopulmonary training, and is needed to help complete their work task. There should be modifications to how the patient is working in order to complete their task, and patient education on safety. Next, interventions should be selected based on the patient's current level of functioning and their job's requirements. It should be done in hopes of returning the patient back to work safely. Specific interventions that could be chosen for the patient is ergonomics for the workplace, patient education for body mechanics and posture, modalities to treat their symptoms, therapeutic exercises, endurance, and cardiopulmonary training. This is a video of two different patient cases. The patient is a 39-year-old female that injured her right rotator cuff 48 hours ago at work. She works in a warehouse and has to push and pull pallets on a pallet jack. She is currently on light duty and is concerned that she will hurt herself again when she returns to work. Alright, what we're going to do today to strengthen some muscles in your shoulder is just work on this motion right here using a weight, alright? I want you to do this 10 times 3 sets. Okay, do you have any questions? Nope. Alright, while you're doing this, let's keep your back straight, these two bones pulled together, okay? Have any questions? Nope. Alright, you can do that. Next, what we are going to do is this motion to build up this muscle that runs right here, okay? Just like this. We're going to do this 10 times 3 sets, okay? Have any questions? No. And again, keep your back straight and your shoulders rounded back, okay? Okay. Alright, so let's say that this is your pallets at work, alright? I want you to show me how you would push it and then pull it, okay? Okay, now pull it back. Alright, great. So what we're going to do is fix your posture, body mechanics with this, okay? Alright, so now I'm going to show you what I want you to do. We want to keep your pallets close to you, okay? I want you to keep your back straight, shoulders rounded back, your elbows close to you so you can keep this tucked in, and push with your legs, not your back. Don't bend at your hips, okay? So it'll look like this. And then to pull it, you can just work on pulling it back like that, okay? If you have any questions, okay, you can do that for me. Alright, great. What we're going to do is apply a cold pack to those muscles to help with the aching. So when you do this at home, you want to keep it for 10 on and 10 off. Make sure that you have a moist towel down before you put the ice pack on it. And to make sure that you can feel all the skin that you're going to apply the ice pack to. Try to keep it elevated. That's why we have you on this wedge. You can do it sitting up if you want to. And you're going to feel first cold. It's going to be cold. It's going to burn some. And it's going to ache. And then you're going to feel numb. And that's completely normal. Alright? Got any questions? Yep. Alright, I'm going to. Does that feel okay? Yeah, it feels cold. Alright, I'll leave this over here and we'll come back in 10 minutes. Alright, here's the call bell. Let me know if you need anything. This patient is an auditor and she is here today because she complains of neck pain and back pain. Okay, so what we're going to be doing today is working on some ergonomics for your workplace. All that means is that's your body's relationship to your work atmosphere. This is going to help improve your posture and decrease your pain. So I'll go ahead and show you what it needs to look like. So we want to keep your hips at 90 degrees, your knees at 90 degrees with your feet flat on the floor. And keep your back straight. It'd be great if you get some lumbar support, like a lumbar roller. You could stick a pillow right there. And next, what we want to do is lower your keyboard. You want your keyboard flat on the desk area so it decreases stress on your wrist. Next, it's also important to keep your shoulders back and your computer at eye level to decrease pain in your neck. So let's discuss these interventions that were used. In the first patient case, strengthening exercises were performed, workplace simulation for pushing and pulling, ice pack modality to treat the patient's pain, and patient education for at-home use of the ice pack, and patient education for posture and body mechanics. In the second case, the patient education was used for workplace ergonomics. Thank you for watching.